The COVID crisis was a great lesson for all of us. We've seen the health system becoming the most important element in our society. Our lives stopped for a while. We were forced to adapt to the lockdown, and everyone suddenly became more aware of the weak points of the public health system. Mr. Zahal Levy has important experience in the health insurance market, and he can offer us more details. Mr. Levy, how do you see the future of the public health system in Romania and the importance of the health insurance in this context?
Well, first of all, one correction to the phrase of the question. You were talking about what we've experienced in the last few months with the COVID issue. I'm not sure it's over. I'm not sure it's not over. I think nobody knows.
It's wishful talking.
Yes, exactly. I think we should be more accurate and maybe modest in assessing. I think that the human power of will and of life is like engineering our mind to think that this is all over and we should put it behind. But this is not yet evident that this is the case. It may be not. And we should be prepared for funny situations that might, or not funny situations, might occur. To your question, I think the health system has arrived to this crisis already beaten down. For many years, I was talking and preaching about the total reassessment of the health policy in Central Eastern Europe, which has actually made the accessibility to the public very difficult, accessibility to healthcare. In many cases, you could just not get service or get nasty service. Come to the hospital and have the need to pay Spaga, sorry for the expression, and
informal payment, to say so.
Informal payment, that's the nice way. There is no nice way to describe this deed. Unfortunately, it is a very miserable situation where excellent doctors that are underpaid got used to fulfill their needs in financial matters. I don't know if I would do differently if I were them, and charge the gap of the money that is actually worth of their service between what they are paid by the government to what they are actually doing. And so the customer has to pay his way through in order to get almost a favor from doctors or from the service providers in the country to get what he needs. And this is a miserable situation in which excellent doctors and medical staff are caught into, and needy people are going and trying to get help. And if they don't have connections and if they don't have a lot of money, their life around this is not easy. Well, this is the way the system in Romania arrived to the crisis, not to mention some inefficiency factor and brain drainage and some old facilities that should have been renovated and they didn't, lack of equipment, old equipment, obsolete equipment. We can talk about many things, but let's not go into this any further. Just say that the crisis has laid another layer of problems and challenges on the shoulders, on the fragile shoulders of the health system. So I don't envy the Minister of Health, or whoever is the leader now of this system. They have a very, very difficult task, which may be very difficult to carry. They are under-budgeted. And you should know that in the state of Romania, the national yearly investment per inhabitant is about 450 euros, 470 euros, something like this. That means that this is the amount of money the government allocates per person per year for medical services. In Germany, just to get the comparison done properly, it's about 4,770. So you can see the difference is huge. So actually, the government is trying to render service through hospitals and through dedicated medical personnel with very, very little means. And that obviously cannot work. When you read this in numbers, it looks to you like dry facts that are not so important, and maybe we can also debate if it's a little bit more or less, and it becomes an interesting academic topic until your mother has cancer and you need to admit her to the hospital. and she needs to get chemotherapy and breast cancer operation or removal or construction, physiotherapy, chemotherapy that is ongoing or other type of ongoing support. And then you see what happens in the daily routine of such a patient. You don't believe what you see. It's very, very difficult. And if you choose to go on a private basis and have your mother get private medical care, that means all the list of services I said and those that I didn't say are going to be given on a private basis. In the next 3 years, she will have to spend something like 300,000 to 400,000 euros in order to afford a good standard of those services on a private basis. So it can ruin any family's medical financial situation and create a big burden. And so it's becoming a very, very complicated story. Don't forget that the COVID is not the only medical star, the only illness that now the health system is coping with. There was a sharp rise in other problems, in other medical illnesses, for example, Alzheimer and dementia and other things that the absolute numbers are growing. So there is a real multi-front battle here that I fail to see how the Ministry of Health is going to be able to confront this with the amount of money they have. And therefore, either they will have to increase taxes, which also that is not something very practical in big numbers anyway, or you as a citizen will have to acknowledge that the only way to complete the gap between what the health system is giving you to what you consider is proper medical care is to have your own private health insurance that you can address any private medical institution whenever you need and get medical care. Otherwise, it will be very difficult for you to fill in the gap and to get proper care if, God forbid, you need it.
Well, it's good to know that we have a solution. So all we need to do now is get more informed and choose that medical product that suits our needs. Thank you very much, Mr. Levy.
Thank you very much for interviewing me, Orana. Very good.